Okay, I think we'll begin. So, thank you everyone for joining us, and welcome to this webinar today, hosted by Nourish. We're going to do introductions in a moment to obviously myself and to our great panelists today, who's joined us to talk about quality in care. We're going to just a couple of kind of house rules to start with. This obviously is recording. So this will be also sent out for those that couldn't make it today. The way that we've structured today, we're going to do the introductions to our panelists, and we're going to have an agenda that we're going to follow as much as possible, but ultimately it's a conversation and sharing experiences and opinions from our panelists today. The way that we like to do the Q&A or any questions you may have is to pop it through the Q&A section at the top or the bottom of your screen, and we'll be able to pick those up, and we've certainly allocated at least 10-15 minutes at the end of this webinar today, of this hour-long webinar, to certainly go through questions you may have for Nourish, for our panelists, or anything you wanted to throw into the mix for us to digest and talk about today. So I guess I'll kick off the introductions. My name's Nathan. I am one of the digital transformation advisors here at Nourish. Been working with Nourish for over 7 years, in particular working with providers like those on our panel who are going to meet in a moment, working on their digital journey, typically from paper, to be able to record and evidence care for those residents or people that they support. And I'm obviously very excited to be able to host this webinar all around the impact of digital care records leading to quality in care, and how is that done, and that's our conversation today. So probably without further ado, I'd like to introduce our panelists today. So I'm gonna go for Zoe straight away, who's on the top of my screen.
Hi there. Thank you so much for inviting me to be part of the panel. I'm Zoe Fry. I'm one of the directors of the Outstanding Society Community Interest Company. We basically focus on sharing and celebrating best practice and helping others to improve. It's open to everyone irrelevant of their rating across LD services, residential and domiciliary care. I'm also a nurse by background and owned my own nursing home for 13.5 years, where we received outstanding ratings from the CQC. And I've had quite a long-standing relationship with Nourish.
Perfect. Thank you, Zoe. Graham?
Hi, everybody. I'm Graham. I'm Quality Director at Ivolve Care and Support. So we provide support to adults with learning disabilities and mental health problems across England and Wales in both residential and supported living settings. I started as a support worker many moons ago, and I've had a lot of experience in my later career with merger and acquisition and many different solutions from a digital point of view to care planning and care delivery as well. So excited to be here and sharing some of my experiences.
Amazing. Thanks, Graham. And last but not least, Garry.
Hi, everyone. Thanks from me as well for inviting me onto the panel. I'm Garry Leach, Director of Data Process and System Delivery at Community Integrated Care. I've been in our organisation for about 9 years now, and I think the last 5 have been where we've properly embraced a digital care planning system. So I've been around that for a good chunk of time and probably learned a good number of lessons that I look forward to being able to share some of today.
Amazing. Thank you, Garry. And thank you all for the introduction. I think the way that we're positioned this, we've got some topics that we're going to go through, and I think the best way is to be able to share experiences, thoughts and opinions in particular, and we'll certainly be able to give ample time to discuss. The first topic is mainly around the title of the role of digital care records in quality care, and how can we use digital to be able to measure quality. And from my experience in particular, working with providers, it can often be quite challenging to measure impact and measure quality in care, because that might mean different things for different people. I guess we're going to open up the question in terms of how has that changed in the way that you do it in your services, and we're going to start with Graham, if you don't mind.
That's fine, thank you. So yeah, for us, I suppose it's changed how close we can get to the minute by minute delivery of care and support, in terms of there's always that difference, isn't there, between quality and compliance. So certainly from a compliance point of view, when you're thinking about the tasks and the activities you have to undertake with the people that we support, the digital system gets as much closer to that, scheduling of activities, seeing what has or what hasn't been done. And it allows you to really then separate out what are outcomes versus what are tasks that you're delivering as well. It's also changed in terms of how we look at quality, the rhythm of how an operational manager manages quality within their home. So thinking very much about what do I do on a daily, weekly and monthly basis, and how does that get me as close as possible to the care and support of the people we're supporting. So yeah, it's just a few thoughts from me, Nathan.
No, that's perfect. And Zoe, anything to add on that point from what Graham's mentioned?
Yeah, I mean, I think it's such a huge subject. I think benchmarking for me is quite a large part of quality, measuring quality. I think it is incredibly difficult to actually measure quality and what the impact is with that. But if you look at clinical outcomes, you know, looking as when I was a provider and looking at my systems, so you could look at risk assessments, you could look at incidents, and then you could review care plans, and you could look at you could measure the outcomes coming out of that, and if things decreased, if things increased, what was the impact of it. So I think going back to what Graham said about real-time monitoring as well, it has such a huge impact on that, which I think in turn is easy to evidence in terms of quality.
Absolutely. Thanks, Harry. And Garry, just on that point about.
I think for me, I find myself in answering this that it is quite a complex question, and I'm really conscious of everybody's idea of where they start when they're starting to think equality is going to differ. And I think particularly when we're talking about using systems that to a lot of people will be new, and actually the quality of how you deliver that new system in the first place is different than an embedded system, and then the measure and quality of care. And both of those are really important when you start a journey in digital care planning and digital care support. I think after 5 years, I think we probably over-measured our quality of delivery to the point that the delivery of the system we probably had some great confidence around. But that then pointed to compliance far more so, as Graham kind of hinted at. And then actually the step into a much clearer data piece around knowing that you're hitting the right tasks and those tasks are delivering something meaningful for somebody. And that, I think, a growth into a meaningful pathway for people and their support, and where digital helps you follow that pathway is where that quality really comes to life. And you can't do that without the digital. You can't meaningfully map all of that in the way that you would want to be able to see that there's been a true quality impact in people. So it properly opens up a doorway to enable that real clear view of a very specific point of care for an individual, how that works from one interaction to the next in their life and in care delivery, to being able to then have a full organizational view. And ultimately that's why many of us have looked at digital systems of any type, is to be able to have a good, clear parachute view of what's going on within services and in the care that individuals receive. And genuinely, without a digital care record, you don't have the ability to do that without doing it retrospectively a week down the line because somebody's turned up and done an audit.
Can I come in very briefly there? I think it's really important as well that that you've got data-driven decision making, and that doesn't just mean about the care needs, but if you've got the evidence there from the care records, you can look at cost effectiveness, you can go and get additional resources, you can go and get additional equipment. So I think that data-driven decision making is really important for quality as well.
Yeah, just to come in on that as well, I'd absolutely agree. I think one of the moments of reality, though, is that from a quality point of view as well, is that although a digital system does give you a lot of answers, the quality of what people put into the system, the information they're recording, just because it's in a different platform doesn't necessarily change that. But that ability to see that in real time and to have that data to flag where there may be concerns with input is something that's really beneficial as well. I think also my experience with a lot of these systems is that you can feel like you're in a sweet shop in terms of the data that you can get from the system. There's so much information, it can be information overwhelm. So what we've done is we've tended to stick to some very key, clear metrics that give us an indication of quality and the care that we're delivering for people. And that then becomes our focus in conversations for our governance framework and through our meetings to make sure really that, in interactions is one that we focus on, that if somebody's not getting the care and support that we've got in that person's plan, what are we doing about it? How do we look at that data at group level and then also at home and person by person level as well?
I guess so. I'm going to come back in now. I think great, Graham. I think that was fantastic, and I think maybe is it about the providers deciding what works for them. So instead of buying a system that allows for all of the data to be collected, actually it's about what do we want and how can we use that system to make it work for us. Because there are so many different systems out there, aren't there?
It's a bit of a minefield when it comes to systems, and not just from the care planning perspective. But I mean, we, as I said before, we've been 5 years on a journey with a digital care record system, but actually we've had about maybe 8 to 10 years of a digital journey in general. And we're probably coming to a fairly pivotal point in some decision making around some of that, in terms of where do we go now? What do we do with the systems that we've got? How do we make them deliver on all of that good, strong data requirement that we recognise as an organisation that we need? And there are so many new approaches and new systems and new integrations that are just pinging up everywhere, that every time you kind of think you almost nailed it down, you got to review all of that again, because here's the next best thing. And I guess the technology is just advancing all the time. But I think if you do start, as the guys have said, if you start from that position of what do we need out of this? What is the data that's actually going to tell us that somebody's getting the right care, that the quality of that care is the way it's supposed to be? Then actually what you fit in around that becomes your ultimate answer, and how you shape those systems becomes your answer.
Yeah, absolutely. I couldn't agree more. And I think that puts us in a really good spot for the next topic, which is how important, and I think we've already touched upon it slightly in terms of outcomes. And I think how important is it when you're looking at a system to have the ability for someone that is being supported and cared for receiving that care being included in their own decisions and outcomes, and has that changed moving into a digital way of now working? Good to Graham for that.
Yeah, it's fundamental. Involving the people we support in accessing their care records, but also involving them in the development. So for me, this is something I'm very passionate about, and it led me down the route of what system should we go with, and what are our key criteria, and the ability for the people we support to develop their own care plans, to tell us how to support them in a meaningful way, has to be up front and centre when it comes to that. And we were using a system previously where you couldn't necessarily communicate through video. And so we had a person we support who his family were going on holiday, lived with his family, and he recorded with his family all of his care plans. So essentially, how do you support me with my medication regime, which is quite complicated. So him and his family recorded that together. So they felt really safe and secure in the knowledge of, I've instructed people of how to support me effectively. But at the time, the system said no, because it wasn't able to allow people to see that. So just through the fact that you can use media, that you can record, you can involve the people in meaningful ways, that doesn't necessarily need to be a written care plan that is on a shelf sort of thing, really drives that involvement of people.
And back to Garry on that point about, and I imagine at community integrated care that's especially for those that you support from experience, that is a big thing around community-based holidays. How is that all, from your experience, following on from Graham was saying.
As Graham said, it's fundamental. I think if anybody that works in our sector doesn't say it's fundamental, they're missing something. But it is ultimately what we're aiming for, and it's not easy. Even with a system that supports it, it's still not easy. And I think we've just started a new kind of project within our strategy delivery to start really focusing on how do we start to improve the dynamic of that, and how do we really increase that level of involvement for them and for individuals that we are supporting within the context of their own care delivery. But how do we make sure that they more influence what we do as an organisation and really drive us as an organisation to make sure that they're at the forefront, not just of every decision, but actually they drive our decisions. And having a system that enables a level of recording within that has got to be fundamental to it. I think the actual transition from not utilising that to a point where all your staff across your organisation are engaged with that in such a way that you truly get a true voice from people that are supported. I think the journey from this is what I think this person's trying to communicate and telling me to, and we know that's what they're communicating and they're communicating that themselves, is always a real challenge. But it's got to be enhanced through means of improved technology, whether that's because you can do voice recording or whether it's because we are able to attach other types of means of monitoring what people are trying to tell us. We've got to get smarter in all of that. So I think there's a lot of strong steps that have been taken in that direction, but it's got a heck of a long way to go.
I couldn't agree more. And Zoe, on that point, is there any kind of outcomes or outcome framework the Outstanding Society use or ways that they monitor outcomes in particular from what's being discussed?
I think from my point of view, again, supporting what Graham and Garry have said, everybody should be involving people in planning their care anyway. I think, but what the digital platform does is it allows lots of different people to get involved. So it's not just about the person, the resident, the client getting involved. It might be the chef. So the chef might know more about the resident in terms of what they like to eat, what they like to drink, and might be able to observe more. So then they could work on something together, and it could be a real, live care plan, document planning. The maintenance man, for example, he might notice something, the housekeeper who spends a lot of time in somebody's bedroom. So it's not just about the resident getting involved, it's opening up to the whole team to get involved. It's not just about your carers, your trained nurses doing that care planning. It's a whole systems approach based on what that person needs and what that person wants.
That's just on that point. I was in a home the other day chatting to a manager, and they were talking about the system that we're using and some of the challenge they got around the quality of input that colleagues were making and how they weren't involving people. And therefore they just came up with this genius little way of describing it to the support workers of, you are the personal Instagram account manager for the person we support today. So when you're on shift today, think about this as being like your Instagram, celebrate the success, but also record what's happening as well. And that actually did just that little snippet, made an improvement to how people were recording as well, but involving people as well in that.
I think the other bit of your question, Nathan, when you kicked it off, was around outcomes, and I think outcomes is another bit that's within that. I think a little bit of a minefield. I mean, yes, absolutely, let's get the right stuff in, but outcomes it's a big picture thing. It doesn't always have to be. I mean, it can be an outcome about a small piece of normal care delivery, and I think we sometimes maybe get overly caught up in outcomes being the big picture thing that I'm going to do over the next 2 years and take lots of small steps towards, but actually being able to see those small steps is the kind of thing that a digital system gives you that you don't get elsewhere. That as well as you try and map that over long periods of time in paper copies that people have tried to do in the past, you don't ever get to as clear a view of all those things that people have done to get there in a real sense. Whereas having a digital care system enables you to be able to properly map that, properly be clear as to what's the ultimate goal we're aiming for, what are all the stages within that goal, and how far are we progressing towards it. So for me, it is fundamental in terms of we have to do it, but it's equally fundamental to have a digital care system to support you to do it and do it effectively.
Yeah, that's such a point, Garry, in terms of then being able to, on the back of that, evidence that and how we're managing that outcome, whether it be small or large, and what that goal is, or what level of support is involved. And I think having that capability we think is so important, and I think it's good. I think any examples that you've got that has enabled you with the digital social care record to be able to not just evidence that, but govern that in terms of monitoring it, whether it's daily or regularly, and with that person, as we talked about. And yeah, it'd be good to hear, Zoe, for example, if you have experiences with that in your homes and services.
Yeah, so coming back to the outcomes point of view, I think in terms of outcomes, it doesn't always have to be, positive. How far somebody has walked, or are they able to stand, but it's about outcomes in terms of people taking risk as well, people doing what they want to do, and the evidence supporting the conversations around that. So outcomes can be such a broad sphere of information. It doesn't always have to be this is our end point.
Yeah, totally. And Graham, Ivolve, how has that changed the way that you talked about it when you have the internal meetings and you look at the impact and the way you measure it in terms of monitoring outcomes and the way that now you govern the quality piece? How has that changed in terms of the way that you report?
Yeah, it's transforming it. And as I said earlier, it's about keeping things simple in terms of what key indicators you want to look at and when. But if you start thinking about on a daily basis, I as a team leader, what am I starting the day thinking about in terms of what activities should be happening for people? How am I organising the shift that I'm running today? Or if I'm the support worker turning up, what have I got on my timeline to do today? And then at the end of the day, have those things been completed? And if not, why not? And evidencing that. So there's that kind of daily rhythm, and then to say kind of weekly and monthly, and using the platform as well to add in some of those essential checks for safety as well, for the people that we're supporting. So making sure that if they're not completed, we respond very quickly to that. And there's also the reality of it is that the system does address concerns that you get from where you've had incidents that you need to learn from, where there may be a safety incident in the organisation. You can very quickly measure or monitor some key activities that the system would give you. So a good example of that would be night checks, which I'm sure a lot of providers will say is an area that is a focus. But being able to have the tags in a room whereby that night support worker is tapping to say that they've done the check can be transformative in terms of safety and governance as well. So yeah, we've really embedded it into our organisational KPIs at every level as well.
Perfect. And Garry, on the data point, again, how is that visible to those that are making those decisions to be more kind of responsive and more proactive? And how's that changed for your experience?
I think data has been part of our organisational journey in terms of getting it to those who need it to help make decisions for about 8 or 9 years in our organisation. We kind of ventured into using Power BI right at that point. And we were really clear that we didn't have an awful lot of information in systems to put into Power BI in the first place back then. So we worked on the premise of what do we have in systems? What can we throw into systems that give us a little bit more insight? And we started from there and we built. And I think Graham's made very clear that you step into a space of danger when that's your approach. And we probably have overdone it in lots of ways and have too much data, and it's been added on to as we've had more available, rather than how do you now consolidate how you go about doing that, which is what we're in the midst of doing now, to try and make sure that people in whatever role they're in within the organisation have the points of data that are essential for their decision-making and actions on a day-to-day basis. And I think that's the bit where it really does become a game changer. It's one thing having stuff that it's a hassle to find, it's a hassle to get to, it's not necessarily as clear as you want it to be. But when you get to a point where you say, actually, this is what you need to know, this is what you need to know every Monday when you come into your place of work, and actually it's going to drive exactly what you need to do for the next week or 2 weeks, depending on the nature of what that data is telling you. And I think that's where the real change of having digital systems comes in. Our organisation now is in a place where decisions don't get made without the data first. So my job in the data space is the tough bit, because nothing gets done unless I'm providing the right data or my team's providing the right reports. And kind of that's the way it should be, because that's your evidence of everything that you need to do, and in turn that becomes then your evidence of why you made the right decisions. And then you can see that the quality of the delivery is related to those decisions, and your lessons learned from that are great. Sometimes we get it wrong, but you've got a real clear tracking of how you've made that mistake and you learn from it very quickly. So yeah, it's definitely a really significant part.
Yeah, I agree, Garry. And I think it changes then as well, how if you've got audit processes in your organization, or you've got teams of people that do audit, how they approach it. Because the compliance element, as you say, the data is told you, our support plan's in date, yes or no, great, we can move on to actually what's the content of the support plan, and is it actually being delivered? So it just does change the focus, and you've addressed some of those compliance issues in real time, rather than waiting till 3 months before someone goes in and does an audit, for example. So
I think it's really important, as I'm putting my nurse hat on now. We're talking about data and compliance. It's the data, the numbers that are coming out of what the clinical team are inputting as well. So data isn't to be a scary word. It's about the outcomes of the residents and using that to be able to influence change. So yeah.
Just on that as well, you think about things like health screening, for example, for people that you support, that just being able to see very quickly how many people have had a health screen within the past 6 months, year, or whatever time frame, has a huge impact on people's health and well-being. And we know that in a lot of the services we provide, the mortality rates amongst people with learning disabilities is a lot higher. And some of that is because of the unequal access to health services. So just by being able to see, has that person had an annual health check with a doctor, and being able to chase down that metric, is actually having an impact on people's lives.
I guess just to chip in, just because I'm a bit data obsessed, I can't help myself. And I get Zoe's point that for some people the thought of data and even using the term is a little bit scary. But actually, so long as it's presented in a way that takes some of that fear away, I think that's a really important factor, because actually there's ways and means of providing insights. The information, however you look at it, and data is just information, is stuff that we all look for in everything that we do every day. So data shouldn't be something that we're scared of. I say that, but also want to balance it off with if you do use a system and you're capturing data through it, you need to ensure that you've got a good bit of structured data. You've got to have fixed data points that allow you to gain insights meaningfully. And I think that for us has been, because of the timing when we started on our digital care record journey, where those more structured data points were harder to achieve, we've ended up in a space over some of that time having too much of a free text space and not enough then ability to report against all things in the way that we would want. So there's a lot of stuff that we're doing to kind of rectify that at the moment. But actually, I think it's really important that people really give that some strong consideration. And whilst when it comes to care and support, having that richness of conversation and depth of conversation and really getting under the skin of what good care feels like for an individual, and that the staff are properly engaged in that, and that's what's getting recorded, that's great. And you want the richness of that, and you will refer to it. And when there's an inspection, you'll jump to that, because that's where the great stories of life are, aren't they? But there's still a but within an organisation when you're talking in terms of quality of delivery. You have to have structured data points to be able to report meaningfully.
Absolutely. And I think they've done that for years and years and years within the NHS, and we don't do it enough within social care, but it's using that language. And I think also it's about using data to celebrate what we're doing as well. A lot of people think of data in terms of, somebody's doing it better down the road, but actually what can we learn from somebody who has got the data to support what they're doing? Why has one home got less UTIs than another home? And how can we use that that to improve things in other services.
Yeah, totally agree. And that was a great topic. And I think it kind of leads us on nicely, dare I say it, regarding inspections. And I think you talked about it, Garry, in terms of, I guess, how then that is changing the way that CQC in particular, or obviously other jurisdictions and governing bodies and inspectors carry out visits. We hear obviously all the time that they're continually moving to not just a digital approach and a digital way of potentially inspecting, but I guess what has your experience been seeing it from both sides and how's that changed the way that they do their inspections? I'm going to go back to Zoe, if that's okay on that one.
You might have me for the next half an hour now. So from my point of view, I was there at every single inspection, and having digital records, whether that be, care records, whether it be, different audit systems, etc. It was just the way forward. We could show how, when something happened, what happened after it, what the review process was, and how you continue to monitor that. So I think starting from, if we just talk about instance, for example, starting from an instant, what happened, what's been done about it, how are you reviewing it, who have you involved in the process, and actually what is happening 6 months down the line based on that instance 6 months ago. So absolutely, I think I'll give you one prime example. Medication reviews, for example. We used to have our pharmacists come in and get involved with difficult conversations with residents, with their families, if they didn't understand their medication. All of that is documented on the systems and is shared in terms of a collaborative approach, and it's really easy to bring that up and refer back to what happened. And it doesn't just have to be about one area. So if somebody's had a fall, for example, where has the pharmacist been involved, who else have been involved, and that is so easy to bring up on systems and show your inspectors and showcase what you're doing. And even better, having a resident or a relative showcasing it, sharing the system, saying, this is what I've been part of, this is my care plan. I get very excited about it.
I love that. Thank you, Zoe. And Graham, I'm following on from that same point, but also I'm very interested in understanding that Ivolve got services in Wales and other jurisdictions, and how that may differ, or your thoughts on that.
Well, yeah, I suppose across both inspectorates, we see that using the system just makes it easier to understand what information to share. It's the click of the button report to say, what's this person done for the last week, and it's a timeline that you're just able to share physically with the inspector. We've taken the approach, though, of having temporary logins for an inspector. So on the day that they turn up for inspection, they'd get a temporary login. We would sit with them, obviously, and guide them through the system. But in terms of sharing data, knowing what the inspector has access to and the confidentiality for the people we support, it just means it's a bit neater. I mean, we still do get inspections where we're asked to email rafts of documentation or through a portal, but certainly giving that login feels more secure. Yeah, and I suppose across England and Wales, has it made much of a difference? I think, to be fair, for both regulators, that the onus is on them. They're still asking the same questions. They still wanted to see the same things. It's just presenting it in a slightly different in a different format. So the other thing that's quite useful for us, we do support people who don't receive regulated care. And so this is much easier for us to be able to go, well, actually, these people come under that registration versus these people don't as well. So, yeah.
That's great, and I love that transparency, that you've got that confidence in providing a login, and I think that just shows how then that you've got that level of oversight like sort of never before, in terms of the confidence in the data that we talk about, and that's great. And Garry, on that point, and similar for community integrated care, I would imagine, in terms of the different inspectorates and the way that your services are regulated and inspected.
I think, I mean, like Graham said, I think questions haven't changed as a result of the systems being there. I think expectation has. I think both. I should have said we work in Scotland as well as England, so both of those settings, I think it would be fair to say that inspectors do expect to see a better depth of information, and rightly so. I think that expectations are heightened to a point at some of that stuff that I was talking about in terms of seeing somebody's improved health, and how the ability to see data points being utilised to drive improvements for people, whether that is in the health space or whether that's in other areas of outcomes. I think there is an expectation that we are using it to that sort of depth that makes a difference to an individual in a way that they would never have asked before we had digital care systems in place. I think we've had an interesting situation in terms of the extent to which inspectors are looking for data in advance of any actual inspection visits. And most of that, I think you expect, as we always have, that they might pick a handful of people at different settings when you operate the types of services that we do in kind of shared housing settings. And you kind of go, okay, here's the files in advance, we'll send you over a load of paperwork and you can have a nosy. So that feels still an appropriate level of data access, even when you have a system. But we have had a couple of instances, and they've actually been in Scotland rather than England, where an inspector's asked for all access to 3 services worth of all people's theirs support plans. Now, I'm curious as to how they have that much time on their hands to be able to read through all of that. But I equally do think whilst they have a right of data access, it raises a question as to what's a reasonable ask and what's not a reasonable ask. And I do think that is something that we probably do need to work with our regulators to be much clearer about. But ultimately, the system makes so much of that much easier. It means that staff at all levels, and as Zoe said, people we support, their family members, can help people navigate some of that information. And actually, from an inspector's perspective, you're going to get a depth of richness out of that so much more by having those conversations at the same time as looking at the information, never mind just looking at it. But unfortunately, not all of them are necessarily engaging with it in the same way. And I do think expectation from inspectors is something that we need to probably have a greater debate about yet.
Interesting, Garry. You just reminded me, we have had an inspection where an inspector has been in another provider who uses the same system, and has gone, oh, they use it this way. I quite liked how they did that. And so I think there's a little bit of sharing for us to do as well across the sector as to how we're using the systems. But that was in Wales actually as well. So yeah.
I think also we need to think it's not just about the CQC. Look at local authorities and them coming in and doing health and safety inspections. Continuing healthcare, looking at the digital care records helps with outcomes there financially. If you have a riddle report, the health and safety executive might want to come in and look at your systems and how they all link in. And also, if you look at, evidence in learning from mistakes. So I love the CQC's issues that they have. I think the latest one was around an incident with a wheelchair user. And then you can evidence within your systems how you're reviewing that, because actually you've learned from an incident that happened nationally, and you're implementing that within your system. So again, you're improving the outcomes of people within your care because you're learning from incidents, and you can evidence that on your care planning system.
That's great. And I think I want to kind of throw that question out to all of us really, in terms of, do we think giving access is the controlled access as providers is the answer, or short term, or is that a long term thing? And or do you think not? I'm just very curious of all your opinions on that.
I think the expectation's already been set. I think we'd be reversing where we've landed, and this is the danger. I think when we suddenly appear and find ourselves in a particular place. So yeah, I do think regulators right across the board and ultimately local authorities will very easily expect now that they should have access to that in the way that we've been describing, that they get a login and get to have a look. And I'm just not convinced that's as reasonable as it sounds.
Yeah, there definitely has to be some control around it, doesn't there, as to what's appropriate for people to access. And that's the great thing about having a login as well, as you can control the permissions and what parts something can and can't see. But I think the bigger bit across the sector around the data that we'll all be having in various systems and the overall monitoring, there's a lot of duplication where we're sharing information. You think of the capacity tracker, you think of the information we're submitting through PIRs as well. It'd be great if there was some way, and it's bigger than one system. This is a sector thing of being able to, what are those key bits of data? We're coming up to the vaccination season now, and we know we're going to get requests of, how many colleagues who got vaccinated, how many people support, etc. That data's there. Having to fill in a spreadsheet, or there should be ways now as we get better with our systems of improving data sharing.
I think the conversation has to be joined up to even do that, though, Graham. And I think the period of going through COVID, I mean, it highlighted a lot of things, but it particularly highlighted some stuff around data gathering and probably started the journey of data gathering across the sector. But actually, in terms of people's understanding of what is it you need to know, if you do want sector-wide data, it was clear that when one person used a term, whether that was staff turnover, take as an example, that one organisation's view as to how you calculate that and what it actually means and how they utilise it is completely different from the next. But it's never defined by the requesters of that collated piece well enough to ensure that you never landed in a position where people were actually giving different data to answer the same question. And there's a seriously broad piece of work across the sector that needs to be done to make that meaningful. And I get the Department of Health and Social Care are working on that within England now, but actually I'm not sure that really gets us to the point that we want it to from a sector perspective.
Perfect. Thanks for that. And I think I didn't want to end on that. I didn't want to end on the inspectors or anything like that. So I wanted to end on a very positive note to kind of summarize and to finish up on today in terms of how I think we've already touched upon it, but how we develop and continue to develop a more proactive versus reactive care approach using digital, which has an impact, on care. And we've touched upon it, but I wanted to highlight on a lot of people come to us and providers come to us, and the biggest thing is time. And I wanted to kind of pose the question to obviously our panelists in terms of, has that been recognised, being time given back? And if so, where on your journey has that? And also, what has that enabled your care team to focus their time more on? And we'll start with Zoe, if you don't mind.
Yeah, no, of course. I think definitely time given back. I think what's quite daunting is the investment at the beginning, and not the financial investment. It's the personal investment of all of your team making that system work for your residents, your relatives, and the team members. But where you come out of the end, it really reduces your workload, and have the live real-time monitoring is absolutely fantastic. I can't even imagine now going back and updating a care plan by hand and rewriting the whole thing again. It's just enabled so much real-time changes and reactive changes as well. Just can't imagine going backwards, because it is so time saving. And in terms of being time saving, it's also increasing the care that you're able to give people within your care.
Okay, thanks. That's perfect. Garry, on that point.
I think I find myself slightly torn by the question, and I do so because when it comes to those who are delivering frontline care, they absolutely gain time by having a digital care system. But I say it with a caveat of the whole point is to be able to record on the go. And actually, that's the thing that's the shift, that it more meaningfully enables we're recording stuff together. We're thinking about what we need to do together. And it means that togetherness and relational part of care and support delivery happens because you're working together on all of those decisions in each of those stages of activity that you engage in. And I think, yes, time is gained, but actually it's gained and utilised in the same space without necessarily saying we gain something else. And I think many of our staff would say that actually what it means is that we get to do more of that activity stuff with people. We're not stuck in front of paperwork. And all that's true, but actually I don't think it's quite as, it's not that you don't get the benefit of that, don't get me wrong. What I'm trying to say is that there's something different that goes on in that space that's far more significant, and actually probably should be spending more time recording, because you are doing it together. It is the stuff that's helping those people that we support be engaged in that care delivery anyway, and the outcomes that they want to achieve are the things that you should be discussing, whether you sat down helping them and supporting them with their breakfast, or whether you're out doing a fun activity in the afternoon, or whatever's going on in the person's life. And I think that's the really significant part of having a digital care planning system, is that we're in this together and we're working together on it, and we're trying to deliver something different. I think genuinely for our managers within our services, whilst there will be a sense of gaining time and gaining more resource from the wider staff team because they've gained that bit of time, I think in reality for them, we have given them a bit of time back, and then we filled it with something else, and then we've given them a bit of time back and filled it with something else. And all of that being the richness of the good stuff of improving care. But it doesn't change the fact that that's the nature of the journey that we're all on, and I think that's what improvement delivers. Improvement's never going to deliver on our service leaders now get to sit with their feet up. So I think for them, it in many ways become easier to do things, but there are more things to do.
I agree on that, Gary. It's time saving and time focusing as well, isn't it? I think it really focuses people's time on the activities that they need to be doing, and that's across the board from support worker, how am I providing support to this person, but also from a manager point of view, the time saved of traveling to a home to look for a document, then to read it, to then make a decision and then discuss it, is that in real time you've looked at it, you arrive at the home and you're dealing with the situation rather than having to do that checking there. So it actually improves the quality of the time you're spending with people too.
I don't think we've mentioned data security. I think that's got to be a positive as well, moving away from paper systems and having a good, robust system in place. Yeah, it's got to be a positive.
That's perfect. Thank you so much. That's been great. I think that concludes the topics, and thanks for so much, sharing so much experience and opinions and conversation on those. And I think that's certainly been helpful. Great to be a part of, and also I'm sure those listening too. We do have a couple of questions, or one in particular in the chat that I think we can throw into the mix over the last few minutes, and I advise anyone on the webinar to obviously ask our panelists while you can, or Nourish any questions you have while it's still fresh, and we can hopefully answer those over the next few minutes of this webinar. Valerie Healy has asked, how does a care provider decide which digital system to use? Should they all be compatible with each other? And I'm assuming that means sort of integrations with current systems or future systems. And I think I'm sure that's from experience from all three on the calls. Zoe, do you want to kick us off on your thoughts on that?
Yeah, so my views would be, go and see the system in action. Whenever we were choosing a system, we asked to speak to providers who are already using it, so get their views, get a few members of your team to review it, see how usable it is, and integration is absolutely key. I think having a company who is already integrated with lots of different systems and is proactively continually integrating with other systems, I think is really important with the way forward that we're going.
I would agree that, although previous experiences, we went down a journey of choosing a very integrated system, so integrated from a care planning, rotoring, all of that perspective, and actually the general approach of those systems meant that the quality of the individual systems wasn't as great. So we actually decided to move away from that. And although the system we're with now does have integrations, working on developing integrations. My focus was we needed a very good quality care planning system that does care planning really well, that is, most importantly, liked by support workers, because they're the guys that are going to be spending the most time on it. So if it doesn't look good and they don't interact well with it, they're not going to use it very well. So when we were selecting, we just, as a lot of people do, we got a number of providers together. We did some demonstrations. We made sure that the right people, the people we support and our support worker colleagues were part of those demonstrations as well. And their opinions helped us select it. But I think the future with, artificial intelligence and things is some of the around the edges stuff will naturally change in the future. But the core processes that you want to get, the quality of that has to be that sort of actual driver and the key.
I think from my perspective, I think very much what Graham just described there in terms of that decision-making process of who's all involved and getting the right feel and things was absolutely key for us for any of the digital systems that we looked at. And whilst we've had systems in place that within our organisation, some of for quite some time, we would now definitely take a line of they at least need to be cloud-based so that we can do something in terms of information sharing between systems. But equally, given that integration is available so much more readily by system providers, why wouldn't you? In terms of our decision-making when it came to our care digital system, we had one underlying start point and statement that it had to be easy to use. And the easiest version of that was essential for us to have within the organisation, because otherwise we knew our frontline workers would not be keen to engage with it. Same issue as Graham has described. And actually we played quite firmly and deliberately in the space of let's look at some systems where your quality outputs were their selling point. And landed in a position where that quality output being pre-designed before you take it into your hands and start delivering on it became far less important. And it was more important that we could get the input end to enable us to deliver the right output, rather than go with here's the output that comes off the shelf, when you knew that you couldn't actually get the inputs that you would need people to provide. So it's really key that you understand that people will or will not use what it is that you look at. For me, that's fundamental. If you can't feel confident that people can record easily, then you aren't going to get any meaningful output out of it in the end.
Yeah, I couldn't agree more. Thanks, Gary, and thanks all on that. I've got a couple more questions that have come in since, so thank you, and keep them coming over the last handful of minutes. Kirsty Scarborough has said, is there anything you would do differently during implementation? We're at the start of our Nourish journey, so that's good. Thanks, Kirsty. I'll throw that into the mix. Anyone wanted to talk about anything they would do differently from their implementation of Nourish?
I saw this ping up and got quite excited, because yes is the answer, and lots. And sorry guys, I've jumped in fast. I think we've had a really good positive journey in lots of ways when it comes to the digital care planning. But we started at a point when we started our journey with Nourish when we were probably keen to get more out of the system than the system had readily developed. And we ended up developing a lot ourselves. So we've ended up with a really bespoke version of Nourish, if you like. And I've shared this with a number of providers. If we could quickly get out of being that bespoke and could take what is now available off the shelf with all of the pathways and all the automations that are coming with that, then we would jump quickly. The transition to get to there for us, because we have gone so bespoke, out of necessity and for all the right reasons at the time, is trickier. And I think where you can meaningfully, and I think these days you can meaningfully get a system straight off the shelf and work with it, I would strongly encourage people to do that. I think in terms of implementation, take your time. And I say that because we were in midst rollout as the pandemic hit and paused what we were doing in terms of rollout across our 500 odd services. And we paused for about 4 months during the first wave of COVID and then made a very clear decision that we had to have Nourish in every other service by the time a second wave hit, on the assumption there would be a second wave. But we kind of threw the system at everybody. So what are the basics that we could make sure we got out to the organisation to make sure that we had a greater level of insight to the care that was being delivered at a point where you couldn't get into services? And that was the right thing to do in the context of a pandemic and the crisis that we're in the midst of. But actually to then try and revisit, to do a proper rollout when people kind of felt that was it, was still continues to be a challenge. And I think the answer to that is taking your time in the first place and making sure that you take the time to make sure everybody's comfortable with it. Everybody's got a real sense of the system embedding within their organisation and within their service and within their day-to-day delivery.
That's fab experience, Garry, and thanks for sharing. Zoe, do you want to add anything to that?
So I think Gary's most really covered a lot of it about taking your time and getting it right. I would also say go with the 70-30 rule. So you're never going to have all of your team members who are completely onboarding. So really grab that 70% of your team members who are loving the system, who work with the system well, and they'll bring other people along the journey. You can't focus on everybody because you're never going to get everybody 100% any kind of a system.
I agree. Don't let perfection be the enemy of progress. Garry, I feel your pain, because we went through the route of not bespoking the system because of previous learning, and the benefits that brings now in terms of automation and stuff that comes through is really beneficial. The only thing I would probably say is now we're nearly rolled out across the whole group. If I could go back and change something, it would be the opportunity to not just use this as a systems rollout training program. If I could go back and actually make sure we're really wrapped into it, how do you write a good quality support plan, person-centered reviewing, those kind of core competencies that you need within the organization? There's actually a really good opportunity whilst rolling the system out to address those. What this system is now showing is where we've got those gaps in knowledge and capability. But there's a real opportunity when you're implementing a system like this to create a training program that really covers a lot more than just a system.
Yeah, really good point, Graham.
Thank you, Graham. Thanks all on that point. And I've got a question from Benjamin Winfield. Would it be possible to hear the views on the use of the family portal and the ability to strengthen relationships with families and friends of people supported? Who wants to go first on that one?
Well, we haven't rolled out the portal yet. We're going to do that in our next phase. We just want to make sure that our teams are really confident we're using the system first, and making sure the quality of what's in the system as well is right before we then get onto that next stage. But I can't wait to. I think it's going to be the families and the people we support are going to be the biggest driver in terms of quality of the information that's in the system as well. So yeah.
I think we do have the portal live in some services for some people, but it is a relatively small number in comparison to the number of people we support. Interestingly, I ended up in the conversation with a couple of other people the other day talking about the family portal, and it is a tricky one. I mean, it feels and sounds like absolutely the right thing to give access to family as to the care and support delivery, and you would expect people to have that in other contexts. So if you I guess if somebody turned up at the side of the bed of somebody in hospital, you as a family member, you with permission would have a little look at the notes. In the context of the kind of care that we deliver within social care, it's 24/7 care with some real complexities around the delivery of that. And I think sometimes the assumption around open access to something that's as broad and detailed as what we actually have within digital care systems may take that to a level that's a little step further than might feel quite as appropriate as the statement under the system opportunity is providing. And I think I, as a parent, remember as my children went through nursery, we got access to a system that enabled us to see all the good stuff that they were doing. and they got great messages pinged up in this system, and we're able to comment on it and comment on the stuff that we would do at home to help in those development areas. I think the danger when it comes to care planning and the nature of how people feel when their loved one is in a care setting often leads to a dynamic not of looking at those great positive stories and the really positive things that are happening in people's lives, but looking for the problem and looking for the error and looking for the thing that somebody did wrong. And it can become a very unhealthy position to land in. And I think that's one of the reasons why we've taken our time to get that to a point where we comfortably say, yeah, that's fine for everyone if they want it. So we've not pushed that in a big way, because actually I think there is a dynamic there that still needs to be fully worked through to get to the right place. It still feels like the absolute right thing to do, and in terms of getting the right inputs into people's care delivery, absolutely you'd want it.
That's great. Thanks, Garry. Yeah, so certainly giving that autonomy and that ability when needed and if required. And I think it's that benefit, isn't it, of deploying it when needed. And I think, is there anything to add on that, Zoe, to finish up on from your experience?
From my experience, my personal experience, if it was me, if it was my mum, if it was my nan, I would certainly want access to everything. Openness and transparency for me all the way.
Perfect. Love that. Thanks, Zoe. We've actually run out of time, so that has been super helpful for me in particular, but I'm sure for many people listening, and thank you so much for joining us today, and of course thank you for our three panelists, and that's been wonderful and great to discuss the topics with you today, and I hope that you've enjoyed that one too.
Thanks, Nathan.
Yep, thank you very much.
Thank you all. Take care.
Cheers. Bye.
Bye.